Hello guys, welcome back to my channel. Hope everyone is good and everyone is staying safe, staying at home, sanitizing when they're going out and washing their hands as frequent as possible, especially when coming back from outside or going outside. And to all the healthcare workers working out there, continue staying safe and regardless of the lack of PPEs, let's continue trying by all means to stay safe and taking care of our patients. And let's get into the video. Okay, so today I'm going to be talking about internship, what to look for, and how to choose an internship place of learning. Okay, firstly, what is internship? Usually, people that study in China use the phrase internship referring to electives, clerkship, and so forth. So what happens is basically you go to a country of your choice and then you go learn your practicals for a whole year. So basically when you go to those countries, what you usually do is when you get there, the moment you say internship, people misinterpret and think that you've already graduated, but that's basically pre-graduation internship that you do for a year. So what I'd advise you to do is when you're looking for a place, when you get there, talk about a clerkship, talk about electives, and explain to them what you want from the hospital or from the institution. Okay, let's get into it. So the first thing to think of when you're thinking of doing your internship is going to be the country and the language. So you can be going to a country where you actually don't know the language at all, or you have no one to go with who actually knows the language. Because if there is 2 of you or 3 of you at least, and one of you knows the language, it's easy to communicate. That's one of the reasons I didn't stay in China, because my Chinese is very bad. I'm able to communicate, but medical Chinese is the pits. So I decided to do my internship in Botswana, and doing my internship in Botswana, I can speak the language, or rather I can try speak the language, and it's close to home. The next thing to think about is money. Money plays a huge role. How much is it gonna cost you to go do your internship in that country? Is it free? Is there different prices for people from different countries? For example, these different prices here for people who are from SADC, for people who are from the country, for people who are international outside the SADC region. So check your prices. And I think the pricing for here, I'm not sure if it's still the same, but when I applied for people from SADC region, it costed 10,000 pula for 8 weeks. So every 8 weeks, 10,000 pula. The next thing to consider is exposure. Are you going to be able to have exposure and learn and practice? For example, when I'm doing my internship in Botswana, I was able to get a lot of exposure and a lot of practice, a lot of learning, and a lot of hands-on. Whereas I know people who were doing the internship in places like the United States, and they were not able to get as much exposure as possible. It's totally different, and you're not allowed to touch the patients. All you do is observe what's happening, and that's what I didn't want for myself. So, and not just that, but also the money. I didn't have the money to go to the US. So the next thing to consider is transport and accommodation. When you're doing your electives, if by any chance it's possible for you to be able to get a car, I would advise you to get a car, because when you don't have a car, you are fully limited. You can't just wake up in the middle of the night and say, I want to go to hospital. Say you're studying at night and you come across something interesting and let me just go to the hospital and check on if there's any patient with a similar condition. But you can't do that because you don't have a car. It's not feasible to do it, to just wake up and say, let me call a taxi at 1 a.m. in the morning. But if you have a car, you just wake up at night and just go. And also doing calls, it's kind of if you go on call at night, it's helpful because if you have a car, what do? You can go on any calls and you don't have to actually sleep at the hospital. Go on call around 1 a.m., 2 a.m., decide to come back. If there's anything interesting, ask them to call you, and when they call you, what do? You just go back to the hospital. Accommodation goes alongside with having transport. If you don't have transport, try by all means to get accommodation walking distance from the hospital, or if possible in the hospital. It avoids a lot of costs, and if you're in the hospital, you can just go to the hospital and back as much as you want. And although there is usually hospital transport, but usually by the time they come, that interesting thing is long gone because it's a bit slow, especially because we are students, it's not really a priority. So there is that accommodation and transport. The next thing to think about is the departments in the hospital. Does the hospital have all the departments, or do they have sister hospitals that have all the departments where you can be able to do your internship and have as much exposure as possible? Because in my university, what's required of us is for us to do all the main 4 departments and a bit of stomatology and a bit of ophthalmology, radiology, ENT, psychiatry. And if the hospital doesn't have all those departments, it doesn't really meet the requirements and it kind of doesn't get to work. So just make sure you check if the hospital has all those departments and consult with the hospital or the institution if they have all those departments. What's important is our university requires us to have a hospital that has at least 500 beds. So also check that. It's one of the requirements for my university. I don't know about other universities, but it's something to check because if it's a very small hospital, I don't think you'll get as much exposure as you would in a bigger hospital. So there is that. And the last point is your future. If you want to work in a certain country, I would advise you to do internship there and get accustomed to the culture, get accustomed to how they work in the hospitals, and just getting used to the life in that country, because you'll be a step ahead the next time you come back once you graduate to work there. And if it's your home country, come on, there's no need for you to get accustomed to the situation, but what you can be accustomed to is how everything is done in the hospital. So that is also affected. So because there's different guidelines in every hospital, not everything is done the same way. It's just a lot of headache. And so if you're in a country where you are seeing your future in, it gives you an upper hand on that. So consider your future when choosing your internship. I hope you guys enjoyed this video about internship. If you guys have any comments or have any questions, just comment in the below or send me an email directly, and I'll try by all means to help and reply all emails as soon as possible. Hope you guys have a good day, and don't forget, stay safe, social distance, and sanitize and wash your hands as frequent as possible, and avoid going outside if you don't need to. Have a good one. Cheers.